Good morning, everyone, and thank you for joining me today. We're going to dive into the fascinating world of single subject research designs in applied behavior analysis. Specifically, we'll explore the multiple baseline and changing criterion designs, focusing on how these methods allow us to evaluate behavior change in ways that are both ethical and effective. I'm excited to share insights and practical applications with you throughout this presentation. Let's get started. Single subject design center on tracking how behavior changes within individual participants rather than looking at groups. This approach is really helpful for understanding the unique effects of an intervention on a specific person. These designs are especially common in applied behavior analysis, or ABA, where the goal is to carefully assess how interventions influence particular behaviors. A key part of this process is maintaining strong experimental control. This means we need to be confident that any changes we see in behavior are truly due to the intervention itself and not influenced by other outside factors. Ensuring this control is vital for both research and practical applications in ABA. Multiple baseline design is a method where we introduce an intervention at different times rather than all at once. This staggered introduction allows us to observe changes more clearly. Importantly, this design can be applied across different subjects, behaviors, or settings, which helps us establish a cause and effect relationship. Another key advantage is that it doesn't require withdrawing the treatment, which is especially useful when taking away the intervention wouldn't be practical or ethical. Finally, by staggering the start of the intervention, we can demonstrate experimental control effectively without needing to reverse the treatment, making this approach both flexible and powerful. Multiple baseline designs can take different forms depending on what aspect is staggered. The first type is across subjects, where we look at the same behavior but in different individuals. This approach helps us see how a treatment works across various people. Then, we have designs across behaviors and settings. Across behaviors means we focus on different behaviors within the same person, which is useful when multiple behaviors need addressing. Across settings involves observing the same behavior but in different environments, helping us understand how context influences a behavior. Each of these types offers flexibility, allowing us to tailor the design to best evaluate the effectiveness of interventions. Here, we have an example of a multiple baseline design in action. First, we introduce a social skills intervention to 3 children, but not all at once. It's done sequentially, one after another. Each child has their own baseline period, and these periods start and end at different times before the intervention kicks in. When we look at the data, we see stable behavior during these baselines, which then improves right after the intervention begins for each child. This pattern makes it clear that the treatment is effective, and importantly, we can demonstrate these effects without needing to withdraw the intervention at any point. One of the key strengths of the multiple baseline design is its ability to control internal validity threats, like history and maturation. This means we can be more confident that the changes we observe are actually due to the intervention, not some outside factor or natural development over time. Another important advantage is that it maintains ethical standards by eliminating the need to withdraw the intervention. This is crucial because removing a beneficial intervention just for experimental control can be problematic. Additionally, the design is highly adaptable. It can be applied across different subjects, behaviors, and settings, which makes it very versatile in various research and clinical contexts. Finally, it's particularly suitable for situations where reversal designs would be unethical or impractical, allowing us to conduct rigorous research without compromising ethical concerns. While the multiple baseline design is a powerful tool, it does have some limitations we need to keep in mind. First, it requires collecting numerous baseline measurements, which can be quite time-intensive. This means it takes longer to gather enough data before any intervention starts. Second, there's a risk of behavior change generalizing across baselines. In other words, a change in one baseline might unintentionally influence another, making it harder to isolate effects. Finally, interpreting the results can get complicated, especially if changes happen simultaneously or overlap across different baselines. This overlap can make it challenging to clearly understand which intervention caused which effect. So, while useful, this design requires careful planning and analysis to avoid these pitfalls. The changing criterion design is a method used to shape behavior by gradually adjusting performance criteria in preset steps. Essentially, it allows us to guide behavior slowly toward a desired outcome by setting successive goals that become progressively more challenging. This design is especially useful for behaviors that require stepwise improvement. Take, for example, increasing study duration over time. One of the most important features of this design is how it demonstrates experimental control. Instead of requiring a return to baseline behavior, it links changes in behavior directly to the shifts in criteria, making it clear that the adjustments in behavior are a result of the changing goals themselves. Here we have an example of a changing criterion design in action. First, we start by gradually increasing the intervals of independent reading for a student, setting successive steps as a criteria. Next, we observe the corresponding graph, which clearly shows that the student's behavior changes closely follow each new criterion step we've set. Finally, this direct alignment between the criteria and the observed behavior validates that each adjustment has a genuine effect on the student's reading behavior. This method allows us to see how specific, incremental changes can effectively shape behavior over time. One of the main strengths of the changing criterion design is its ability to gradually shape complex behaviors over time. This makes it especially useful when you want to build up a behavior step by step, rather than expecting an immediate change. Another important advantage is the ethical aspect. Since it avoids withdrawal phases, which can sometimes raise ethical concerns, it ensures that participants aren't subjected to potentially harmful conditions. Lastly, this design offers strong experimental control. By linking changes in behavior directly to the adjustments in the criterion, it clearly demonstrates that the behavior is being influenced by the intervention, making the results more reliable and convincing. When we consider the limitations of the changing criterion design, there are a few important points to keep in mind. First, this design is only applicable to behaviors that can be gradually increased or decreased. It's not suitable for behaviors that can't be modified in small, incremental steps. Second, interpreting the results can be tricky if the behavior doesn't consistently match the changing criteria. If the behavior fluctuates or doesn't follow the set pattern, it becomes harder to draw clear conclusions. Finally, this design isn't appropriate for sudden or unpredictable changes in behavior. Since it relies on gradual shaping, it doesn't work well when behavior changes abruptly or doesn't fit a gradual progression. These limitations are crucial for deciding when this design is the best choice. Here, we're looking at two different research designs used in behavior analysis: the multiple baseline design and the changing criterion design. The multiple baseline design is useful because it introduces interventions at different times across various subjects, settings, or behaviors. This staggered approach helps us demonstrate control without needing to withdraw the treatment, which can be important when it's unethical or impractical to do so. On the other hand, the changing criterion design revolves around gradually shaping behavior by setting a series of performance goals that change over time. This way, you can track the individual's progress as they meet each new criterion, showing how behavior improves step by step. Deciding which design to use often depends on the specific behavior you're targeting and whether it's appropriate or ethical to withdraw treatment or shape behavior incrementally. Understanding these differences helps ensure the chosen method fits the situation best and maintains ethical standards. When planning your study, it's crucial to carefully map out your baseline periods. This helps prevent any overlap in intervention effects, which can complicate your results. Keeping a close eye on behavioral data is equally important. Consistent monitoring allows you to spot emerging trends and maintain reliability throughout your research. When you decide to adjust performance goals, make sure your criteria are clear and consistent. This transparency strengthens the integrity of your study. Don't forget to factor in ethical considerations when choosing your design type, as respecting participants' rights and well-being should always guide your decisions. Finally, combine visual analysis with statistical methods when reviewing your data. This dual approach provides a fuller picture and supports more informed decision-making. To wrap up, flexible and reliable designs like multiple baseline and changing criterion are essential tools in behavioral research within ABA. Each design comes with its own unique strengths and limitations, which means we need to carefully choose the right one depending on the intervention scenario. By following practical implementation tips, we can strengthen the validity and trustworthiness of our findings, ensuring our results are solid. Overall, these single subject designs play a crucial role in advancing evidence based practice in applied behavior analysis, helping us deliver more effective and scientifically supported interventions.